Neurotrophic keratopathy, or NK, is a degenerative corneal disease caused by impaired corneal innervation. This means the nerve supply to the cornea, the clear front surface of the eye, is damaged. Because these nerves are crucial for corneal health and function, loss of sensation can lead to severe complications, including corneal breakdown, ulceration, and even perforation. This video will explore the causes, symptoms, diagnosis, treatment, and management of this potentially sight-threatening condition. So, what causes neurotrophic keratopathy? The underlying cause is damage to the trigeminal nerve, which provides sensation to the cornea. This damage can arise from a variety of factors. Common culprits included herpes simplex or herpes zoster infections affecting the eye, known as herpetic keratitis, surgical procedures such as corneal transplantation, refractive surgeries like LASIK or cataract surgery, systemic diseases such as diabetes, multiple sclerosis, and rheumatoid arthritis, topical medications, especially prolonged use of eye drops containing preservatives or topical anesthetics, corneal tumors, and finally, neurological conditions that affect the trigeminal nerve pathways. The pathophysiology of NK is relatively straightforward. Reduced or absent corneal nerve function disrupts the normal corneal physiology. These nerves are responsible for stimulating tear production, promoting epithelial cell turnover, and releasing trophic factors, molecules that nourish and maintain the cornea. Without adequate innervation, the cornea becomes vulnerable. Reduced tear production leads to dryness. Impaired epithelial cell turnover slows healing and increases the risk of breakdown. And a lack of trophic factors weakens the corneal structure, making it susceptible to ulceration and perforation. Essentially, the cornea loses its ability to repair and protect itself. Determining the exact epidemiology of neurotrophic keratopathy is challenging, as it's often underdiagnosed. However, estimates suggest it affects a relatively small percentage of the population. Prevalence is higher in individuals with risk factors, such as herpes infections, diabetes, or a history of corneal surgery. More precise epidemiological data is needed to better understand the true burden of this condition and to identify populations at higher risk. The signs and symptoms of neurotrophic keratopathy can vary depending on the severity of the condition. Early stages may present with subtle symptoms like mild dryness, blurred vision, or foreign body sensation. A key feature is often a lack of pain, even when the cornea is damaged, due to the nerve damage. As the condition progresses, more severe symptoms may develop, including persistent epithelial defects, which are areas where the corneal surface is eroded, corneal ulceration, an open sore on the cornea, corneal thinning and scarring, leading to vision impairment, and in severe cases, corneal perforation, a hole in the cornea, which can lead to serious infection and vision loss. Because of the lack of pain, patients are sometimes unaware of the severity of the damage until it is quite advanced. Diagnosing neurotrophic keratopathy requires a thorough eye examination and a careful review of the patient's medical history. Several diagnostic tests can help confirm the diagnosis. These include assessing corneal sensitivity using a cotton wisp or a Cochet bonnet aesthesiometer to measure the patient's ability to feel touch on the cornea, performing a slit lamp examination to visualize the cornea and identify any epithelial defects, ulcers, or scarring, performing corneal staining with fluorescein dye to highlight any areas of corneal damage, in vivo confocal microscopy, a specialized imaging technique to visualize the corneal nerves and assess their density and morphology. These tests, combined with the patient's history, help the doctor to accurately diagnose NK and determine its severity. Neurotrophic keratopathy is often classified based on its severity, most commonly using the Mackey classification. Stage 1 is characterized by mild epithelial changes, such as punctate epithelial erosions. Stage 2 involves persistent epithelial defects that do not heal despite conventional treatment, and Stage 3 represents corneal ulceration or perforation. This classification helps guide treatment decisions, with more severe stages requiring more aggressive management. The primary goal of neurotrophic keratopathy treatment is to protect the cornea, promote healing, and prevent further damage. Treatment strategies vary depending on the stage of the disease. For Stage 1, treatment may include a preservative-free artificial tears to lubricate the eye, topical antibiotics to prevent infection, bandage contact lenses to protect the corneal surface. For Stage 2, in addition to the above, treatments may include amniotic membrane transplantation, which provides a protective layer over the cornea and promotes healing, tarsorrhaphy, a surgical procedure to partially or completely close the eyelids to protect the cornea. Stage 3, with ulceration or perforation, may require cyanoacrylate glue to seal small perforations, corneal transplantation to replace the damaged cornea. A newer treatment option is Synergimin eye drops, a recombinant human nerve growth factor that promotes corneal nerve regeneration and epithelial healing. This medication is particularly useful for moderate NK, Careful monitoring and adherence to the prescribed treatment plan are crucial for successful management of NK. While neurotrophic keratopathy cannot always be prevented, especially in cases related to systemic diseases or previous surgeries, there are steps you can take to reduce your risk. If you have diabetes, maintain good blood sugar control. If you have a history of herpes simplex or herpes zoster infection, follow your doctor's recommendations for antiviral treatment. Avoid prolonged use of topical eye drops containing preservatives. After corneal surgery, follow your doctor's instructions carefully and attend all follow-up appointments. Early detection and prompt treatment of corneal problems can also help prevent the development or progression of neurotrophic keratopathy. The prognosis for neurotrophic keratopathy depends on the severity of the condition and the underlying cause. With prompt diagnosis and appropriate treatment, many patients can achieve significant improvement in their symptoms and prevent vision loss. However, in severe cases, vision impairment or even blindness can occur despite treatment. Recent research has focused on developing new therapies to promote corneal nerve regeneration and improve corneal healing. Synedromin eye drops, as mentioned earlier, represent a significant advance in this area. Other areas of research include gene therapy and cell-based therapies to restore corneal nerve function. Ongoing research offers hope for improved outcomes for patients with neurotrophic keratopathy.